mill rate, what it was is I was easing your pain by doing this. So it's actually every bit of part of you. Everybody here built this, built the strategic plan and put it together. So everything that we're doing that, yeah, and everything about the strategic plan comes down to about what all the employees here are doing, not just what management is doing. We're taking what you have said, not only through the SWOT, but through all the ideas and everything you've talked about, and we're putting those into action. All right, so where are we going? A strategic plan, the old way of doing a strategic plan, and then the new way. It was pretty funny. I kind of get into memes a lot of times, so Allison happened to be seeing something that I posted on Instagram about how the strategic plan, we're gonna strategic plan like we strategic plan, the old strategic plan, not the, and I must have said it like 4 times, and she wanted to do a meme of it, and she was terrified of doing a meme, and I go, no, go ahead. So I did one making fun of myself, but there's an old way of what strategic plans look like, and then there's a new way of the strategic plans. So every health department kind of does it about the same. How they got to that is a little bit different, but the way that they implement it has always been, we're gonna meet 1 or 2 days and we're gonna try to figure out where we're gonna be in 3 years and put a list of things together on the way that where we need to be in 3 years, but it's so rigid. There's no wiggle room. So for 3 years, we have to look, smell, taste, and act exactly the same. And then hopefully we change things a little bit through those 3 years and come out to where we thought we would be 3 years prior. Well, this is what we ended up getting. We did a video, and then I did a little video, and that was handed out. That's also available to everybody. The link was given out in the email. And this is after we had Steve Long in New York come up and help with us. They helped us put together sort of what a map looked like. But Joy's group went through, completely redid it. Was it just you and Sharon? And it was.
I mean, we didn't change the words.
Not the words, just the way the structure looks itself. Yeah. Because the way it didn't have a good flow to it. It had all the right information, but what's been changed is the flow. So this is what it's a modified strategic plan, just a little map of but how do we get from this nice colorful map to changing things in the department? Because if you saw this map, it says, even if we go back to the other slide, if you saw this, it said increased billing efficiency. So how do we get from increased billing efficiency, how do we get from that where it says that to actually doing it? And that's where our action steps come into play. So if you see these 2 different maps, they're actually the same map. It's just the structure's a little bit changed, because if you look at this one, it goes from the objective, but then you kind of go to a target, the initiative, and then into the middle of the measures. That's all we did was change that. But I want to make sure that you all have access to it. This is where it's at, under the iDrive Strategic Plan 2019. Everybody has access to that drive, to be able to get in the iDrive and look at it. That's, if you wanted to look at it, it's only 7 pages, 8 pages maybe. That's just where the direction of the department is going, and you can see where these action plans are. And I know it's a little bit too far away, but there are 4 headers that we have: financial, customer, internal processes, and learning and growth. So if I go back, financial, customer, our internal processes, and growth. So what we did to get to those action steps, to get to that bubble, to actually coming up with something like a resolution. So to come up with some sort of solving process, we broke it down this way. Our priority, financial. If we picked one of them was increased billing efficiency. And one of those was increasing MAC billing. That's one way that MAC billing is one. Health departments, not a lot of health departments actually do a lot of MAC. So where I came from, they barely did any MAC at all. I mean, there might have been only 5 employees included in MAC out of a department of 60 people. Here, it's completely different. It's a lot of money that comes in through here. And we legally are billing properly. But it all comes down to, did we teach you how to do it properly? Because what happens if you bill for something that you shouldn't be billing for? That's prison time. I mean, wouldn't be you, it'd be me signing it. You get to go to jail. So instead of it.
Don't wear that out.
Yeah.
If you go to jail, don't wear that out.
So.
Oh yes, do. They'll have the bat.
Tiffany. Oh, what a vision I've got in my. All right, so how we're going to do strategic planning now is not going to try to forecast how we're going to do something in 3 years. We're looking at it not only quarterly, well, yearly, maybe every 6 months, but we're putting we went into incident action. We put together, we went incident command mode. We put together an incident action plan, and we'll be reporting out on these either quarterly, but we'll decide with each one. Right now, it's a 3-month incident action plan. This way we get to practice incident command. So it becomes, remember, when everybody went through incident command training, you use it either for an event or an incident. Well, we're using this as an event, something that we can plan and practice this. But one of the ways Sharon came up with this, it's just a way to take that bubble and get it into an action. So if we said increase MAC billing, one of the action steps that we came up with was call Kim Dick to come up and provide the training to do it. And instead of having it as a self-training program, actually have those that we've earmarked that we're going to do MAC training with, or MAC billing, have them actually take a training that's 20 to 30 minutes, or however long it gets designed for. But the strategic plan, I don't want anybody walking out thinking, oh my gosh, when am I going to get tapped to have to do something with the strategic plan? You kind of already did the majority of work. You put together all that time in September. Every time you come past the door and you say something. Every time you tell your supervisor, I'd like to do this, I want to do this. What about this idea? Every one of those things, look at the outreach stuff. That's when it goes to learning and growth. Those ideas, what we sat around this table a week and a half ago, those ideas came up and we said, hey, remember this? We came up with a lot of stuff already of action steps. We're kind of complying with the strategic plan. We kind of started six months ago. People started talking, saying, let's do this. So with this, right, we're almost done. Vi's already got one thing. She already got me the list of MAC participants. I mean, instead of measuring those, we're measuring all of our successes, and that's when we get into measuring it itself. So, Vi's already complied with one thing. It was very simple. It took you how long? Almost nobody else will actually have to do much other than the job with your strategic plan. You already have kind of an idea where you want to see us in 3 years. So, the new way, that's how we're changing the way we're doing strategic planning, and then transition into performance management. So, I gotta get my prop. How are we going to measure? How are we going to? No. I took this in the bathroom with me. I mean, well. Oh.
I'm not saying it.
And I did a wall when I went to wash my
It's kind of freaking me out that she's been.
All right. So, what did we used to do? I know I couldn't get that word out of there. And those are the action steps that we look for performance management. So, and this is what this may have looked like. And you may have heard us talk about this before and how we measured what we did. And so the last time that this was done, it was done based on a set of standards, bubbles, let's say, but the bubbles look different. And then there were meetings and it said, okay, we're gonna take those bubbles and we're gonna say, this is where we're gonna be in 2019. And we're gonna, before we have to do another plan, and we're gonna have all these action steps in between that time. So I'll give you an idea of those action steps. One of them, employee retention rate, increasing the employee retention rate to a goal of 80%. So when it says a goal of 80%, what are you trying to say with a retention rate? What are you saying when you put that together? What does it mean to you if you keep 80% of your people? For how long? For how long? I mean, okay, if you're looking at it monthly, you could have a 100% retention rate and it mean absolutely nothing to you, but yet you got a green. It's green. Let's just take this first one alone though. It said employee retention rate at 80%. You know, in December, we were at 80% until one day. And what happened in one day? 3 people retired. And then we dropped to 74%. Then it looked almost, if you look at it just on paper, it went yellow and it looks like we suck. But no, we don't. Nobody did anything. Should retirement be celebrated or should it be a failure? It's a success. You got there. I mean, maybe we should say they lived at 60, you know. There's a success. All right, and another one, employee performance evaluations, 59%. Well, how can we let you do a performance evaluation if we don't actually provide a structure that gives you the time to be able to develop your employees? So it always looks like it gets worse and worse. Julie, when I got here, Julie had over 30 people underneath her. 30 people. How can you do, your job would be full-time, doing performance evaluations for all the employees. 30 people. If you don't put the structure, and then that looks like a failure. Is Julie a failure?
No.
No, she's got great monkey pictures. Julie's not a failure. But sometimes that's how those measures can come out if you try to forecast where you're going to be if you don't put the structure in there itself. So, to give you an idea, an example of... Oh, yeah.
Of course.
So, I'm going to give you a different example. All right. So you saw that one. You saw Julie. The first thing that she talked about was positions, movements, and positions, and stuff like that. All right. And one she brought up was Jennifer, Jen Wagner, and Help Me Grow position. All right. So when we started looking at that and what Julie was responsible for, and then what Jen was responsible for, when you look at Jen's original job description was completely different, and the contract, both of them were completely different than what Jen was doing. But there was another thing I had heard about 4 months ago, well, about 5 months ago. Julie and Jen came in the office and they started talking about expanding the program. And then I heard another thing. The other thing was that Jen, in her current position, was only allowed to supervise 7 people per Help Me Grow standards. But we were being courted by Putnam, Paulding, Wood County, Van Wert to do their Help Me Grow program, but there was no way that we could expand. Now, we had the board meeting on Tuesday, created that position. Jen went right into the position because it was her job description. Just a couple things were changed to it. So that way we could put a mid-level supervisor in there and build that product in there. Get the infrastructure ready to go in case we ever get asked again. Anybody know who was in the building on Thursday? Who was in the building on Thursday? Help Me Grow, ODH's Help Me Grow program, and they looked at us and said, we were thinking about coming up and seeing if you'd like to grow, if you have the capacity to do that. And I'm just kind of walking by and I went, did Jen tell you what just happened on Tuesday? They go, no. And Jen's like, do you want to come in here for a second and just talk to him? They were so excited to hear that possibility exists. But not only does that, do we believe in the Help Me Grow program and what it does? Mm-hmm. But now, if we believe in that program and the services that it provides, why not have a program like that and get it to grow? There are a couple things. Sharon's going to Greenbelt training. Maybe one day we'll be able to say, we have a service here that we can charge that other company for, that she can provide that training. That's what Steve Long was here for. We paid him $5,000 to do it. The county commissioners have already asked, they said, you have an HR person. Yes, and when she's fully trained, they've already asked if there's some way that we can partner with them and they could pay for that service. Yeah, we can. So, but we provided that infrastructure, but there's something else that it does internally. So if we go back briefly to right here. When we get to learning and growth, so how do we develop employees? Well, you can kill 2 birds with 1 stone. So when we did that upgrade with Jen, and there's a blank spot, a hole there. And then, so the other thing we have to do, Jen, after she starts getting transition, it has to create a job description for not the same replacement as her, but Help Me Grow visitors are paid at level 4. She's got to create a level 5 mid-level supervisor. So by creating a different hierarchy within one division without having to spend any extra money, what did we also now do? We killed 2 birds with 1 stone. What do we do internally?
Give somebody a place to grow.
Now we give them a place to grow. Now somebody has a movement, whether they come from another division and move over, or whether they are in this division, they don't feel, and you and I had this discussion where it looked like it's either there at part-time or it's either Jen's job, or maybe around the department. That's what's going to happen with each one of the divisions. So you can kill 2 birds with 1 stone by being able to create that hierarchy without having to spend the money. Help Me Grow is a money maker. Home health and hospice can be a money maker. Same thing. If we create that hierarchy and put those positions in there, that allows people to stay here. So when you want to talk retention rates, you can talk retention rates because you've allowed people to move. Otherwise, you're squeezing them out. And now you're saying 80% is your go number, but that's not what we would measure. So we did come up with something with a year, 2 years? What was the one we were talking about in the meeting, what we'll celebrate? Instead of, it was 1, 3, and 5. We celebrate the 1, 3, and 5 year anniversaries. Not an 80% retention rate number, but we'd celebrate somebody's anniversary if they're here for a year, 3 years, and 5 years. Not like a month and a half, or anything like that. We looked at some dates that would, with some time frames that would make people go, oh my God, is it that bad that we kept them a month and a half? Congratulations! You're the most senior employee. No. But I can tell you, I can tell you that it's in the next 3 years, through the strategic planning, through everything that we're doing, and everything everybody is doing here. The department, I wish I in some way could say the words that the vision that I see for the department itself, but we have a lot of stuff that other departments do not have, and we're gonna develop the heck out of that. And that's what we're taking out to not only to Henry County residents, but the entire region. And there's no reason not to. They're programs we believe in. So, and they may not look the same. It doesn't mean I'm gonna take environmental health and say, okay, well, we need to put 5 people under John and then we need to make that grow. But what, for example, what if it goes the other way? What if we believe in what John does so much that we end up sharing him to other health departments and having one environmental health director for 5 health departments, but still having 5 health departments? I mean, that's a whole different process, that shared management contract, and that's something I've done as well, and it works. And you guys would love that. We have a little bit of that here. We have contracts here with a 6-pack. We have a ton of different opportunities that we can do, and we're gonna do those. That's why we need your ideas. So, and you've been talking. That's a good thing. All right, so that's all I had, except for the most important slide.
Another picture for
That's it.
You should have changed it.
That's what I had. All right. I was afraid